Good morning. Well, like we've been doing the whole time, first thing, I just want to thank you guys. I mean, we wouldn't be here without you, and this event is our way to thank you for putting your trust in us. So we really appreciate you guys, and we hope that we can continue to care for you and your family members and help you enjoy life as you want to. I am supposed to talk about shoulders. I'm going to get to that a little bit. But one thing I wanted just to discuss is I think it's nice for you guys who don't know me, just to get a little bit of background. You heard a little bit of basics from Dr. Antebi. Believe it or not, him and I, we started as baby doctors together, like he said. I mean, we literally knew nothing together, and they gave us these white coats, and suddenly we were doctors. And so, 20-something years later, here we are. I am originally from Seattle, and so after our training in Detroit, is where Antebi and I trained, I did a fellowship in London, Ontario, Canada for joint replacements and adult reconstruction. As Joseph had stated, I was the first osteopathic physician they allowed there, so it was a very unique experience to be in these innovators. The doctors I worked under were literally the guys who invented some of these pieces that we put in your body. So it was a incredible experience to have kind of an international flavor and to work with some of these guys who were the leaders in their field. Fortunately for me, I also in the training got to work with some amazing sports teams. For those who've seen our profile or anything about us, I was in Boston for a little bit where I worked with the Red Sox and the Celtics under a couple of the team docs there. And then when I was in Detroit, I had the opportunity to work under the docs who take care of the Red Wings and the Lions. So for a while I was very involved in the sports world, and then as I moved back home to Seattle, my kids became into the sports world, so I got off the sideline a little and into the bleachers, and so kind of transitioned to that, but I still do a lot of sports medicine as well as my joint replacement. And then it's almost 8.5 years I think I've been here now. I listened to a friend of mine who convinced me to come down and leave the rain and come look at this big yellow thing in the sky called the sunshine. And so he brought me down here to California, and it's been a great decision. So I've had the opportunity to grow with this group and work with a friend, work with a great number of doctors, and take care of wonderful people here. It is really a unique place here in the Antelope Valley because it's kind of just an isolated little community that has a lot of people and a lot of need. And so it's been just a pleasure to care for you guys. So I'm really happy that that decision to come here. But talking a little about shoulders now. So hips and knees are the most common replacements we do. But shoulders, there's a lot more innovation coming lately in regard to shoulders. Just a quick poll, I'm not going to make you stand up, but if you've had anything to your shoulder, whether it's a rotator cuff repair, replacement, some type of procedure, just raise your hand up for me. So, take a look at that. That's a good majority of people. Thank you, put them down. That's a good majority of people that have had a shoulder issue. And so, shoulders isn't just a replacement. We have lots of things we do. Nowadays, we go in through little poke holes with what's called arthroscopy to try to repair tendons and repair problems or clean out arthritic disease in the shoulder that can get you some temporary relief. There's actually a newer procedure that I've just started to do. It's been around about a year or so, where if you have a rotator cuff that is not repairable, I actually, through the little poke holes, put in this special balloon that goes in between the bone and the tendon to try to fill a space. It's called the in-space procedure. That's very innovative, huh? And again, it's a temporary thing to avoid a larger surgery and to get you some relief. And so again, we're just trying to bring these procedures that really no one else in the area is doing. And then ultimately and unfortunately, if you progress to needing a replacement, now we have different options. We have a standard shoulder replacement, which we do just for the arthritic disease. But we also have ones of people who have a rotator cuff tear that's been a problem. We have what's called a reverse shoulder replacement. And to be honest, I probably do a lot more of those now because people nowadays have waited a long time to get their shoulder addressed and come to me with a very damaged situation. So most of these procedures are outpatient. 95% of people go home the same day, even after a shoulder replacement. Usually you get it moving very quickly, and the recovery is about 3 months or so. So a lot of neat things happening in the world of shoulders and a lot of innovation we can offer. In everything that we do, including hips, knees, shoulders, you guys probably have heard in the news and flyers and things, you've heard of things called stem cell treatments or platelet-rich plasma called PRP. These are newer technologies that are out there, and believe it or not, we offer that. So unfortunately, a lot of insurance still don't cover that, but you know, that is starting to change. But we have things that we can talk to you about that maybe even keep you from getting the surgery right away. So, you know, our goal is to take care of you, not necessarily cut on you, but we are surgeons after all. So just but anyway, so that's what we're doing. This group is growing rapidly. We have a lot of good physicians, and remember, you guys are what we're all about. So we really appreciate you. We want to thank you for your time. So on that, I'll bring it back to you.